is a subcostal view of the liver to see if the liver is seen below the costal margin. I am moving the probe in the subcostal region, so except bowel gases I don't see liver parenchyma. So the liver is not enlarged. Here comes the left lobe of the liver. We can see that the angle is sharp, the outer surface is smooth. Take lamba सांस, blow this all over. Now if we compare the echogenicity of the liver with that of the right kidney, so the echogenicity of the liver is decreased compared to that of the you see now the echogenicity of the liver is equal to that of the renal parenchymal echogenicity, so it's slightly decreased echogenicity of the ladies. This is the left lobe in terms of section. These are the left portal vein branches, this one. These are the left portal vein branches with, and one of the reasons saying that the echogenicity of the liver has gone down, that the echogenicity is decreased, is that you see that the periportal echoes are very bright and prominent. See these periportal echoes, these echoes. Hepatic veins are seen normal in caliber. एक सांस थोड़ा सा लेके सांस रोकें ज़रा, नहीं सांस रोकें, लंबा सांस रोकें. Now here we see सांस ले लें. This is the right hepatic vein, this is the middle hepatic vein, very sharp edges. This is the IVC, and if you see the starry appearance of the minor portal vein radicals, these are all minor portal vein radicals, these bright star-like appearance because of the decreased echogenicity of the liver and the prominence of the echogenicity of the portal vein radicals. Well, this is the tegmental venosum, this is IVC, this is the caudate loop, the segment 1. The outer surface of the liver is smooth, regular. Here you can see this is the outer surface of the liver. Now there is a focal limb. When I place the probe in the subcostal region and ask the patient to take a deep breath, lamba सांस लें, रोको. You do see an focal limb. Then there is another focal limb. There are two limbs. बस सांस बाहर निकालो. This is the second one. And both are in the anterior segment of the right lobe of the liver. This is the focal limb, largest of all, that measures 5.5 into 4.85 centimeters, and the other one measuring 2.4 centimeters by 2.5 centimeters. This is the gallbladder. So no relation with the gallbladder seen. This is the solid focal mass lesion. This is the solid echogenic, coarse echogenic focal mass lesion with internal tiny cystic areas. There are multiple. 1, 2, 3, 4 are seen in this scanning plan. whereas in this you can see the these are tiny cystic areas, all of these. Okay. Now, are these vessels? Without Doppler, I don't have a Doppler. It's difficult to define whether these are vessels in transverse section within the focal lesion, or there is there any blood flow within this focal lesion or not. Now, this is the one we studied earlier. See, it's let's see it in detail. I'm going to give the probe around a sweep to see if it changes its position or not. Now you see a satellite lesion with this large lesion. This is a large focal lesion, echogenic with internal tiny cystic areas. This is the second one. It is lateral, that is medial to it, both having internal cystic areas, multiple internal cystic areas, and these are the echogenicity of the focal lesion itself. This is the cystic area, all this. Now there is no significant posterior wall acoustic enhancement or any shadowing posterior to any both of these. The outer wall of the focal lesion shows a halo around. The halo is in fact representative of compression of the liver tissue adjacent to the mass or the focal lesion. Now you see, this is the focal lesion. This is the echogenic boundary. This is the echogenic boundary, and this is the black area, the hypoechoic area around this solid echogenic mass. Now this is the halo around it, and these are the cystic areas. These are variable sized cystic areas within this, and they are within this solid echogenic mass with no posterior acoustic enhancement or shadowing, and it does not change its shape while the probe is moved. So in a normal, otherwise liver with decreased parenchymal echogenicity, we are seeing a focal lesion with multiple internal tiny cystic areas of variable size and shape. This is with this. Now this can be tuberculoma, number one. Number two, this can be hemangioma, necrotizing hemangioma, large hemangioma, without any investigations. I do not have any lab findings or clinical notes or complete history of the patient. He has just complained with pain in the epigastric region. That is the only complaint with this. See the outer surface. The liver echogenicity has gone down. Yes, that is the one issue. Then there is a solid focal mass lesion with internal cystic areas in the anterior segment of the right lobe. Along with it, we see satellite lesion of same configuration as that of the lateral lesion. This is the medial one, having same configuration, echogenic, no posterior shadowing, halo around, and the tiny cystic areas within it. So there are two in this section. Now along with it, we see that the kidney is normal. It does not relate to the kidney, and when we try to see above the diaphragm, we see small amount of fluid in the pleural space. This is the fluid with lung tissue. Now this view is is to get the this is the third one, close to the diaphragm, same configuration, only the size is different with that of the other limbs. Now this is the fluid, this is the fluid, this is the lung tissue seen in this view. Now this is the portal vein. This is the portal vein, main portal vein. Let's see the left side, the spleen is where it is. Spleen measures approximately 11.7 centimeters in length and is not enlarged because up to 12 is considered normal. The splenic vein measures 6.8 millimeters and is within normal limits, as more than 10 is considered to be abnormal. Now you can see that there is fluid above the diaphragm in the left pleural space. This is very small amount of fluid in the left pleural space from this view. This is the fluid in the pleural space. Minimal amount of fluid is seen in the pleural space. The kidney is normal. Left kidney is okay. Is there any ascites? Now this is the urinary bladder with prostate. And this is the urinary bladder longitudinal section, and these are the bowels, and this black area that you are seeing is the fluid in the dependent region of the peritoneal cavity. So there is minimal ascites in the dependent region peritoneal cavity. These are the vessels in the left lobe of the liver, ascending portion of the left portal vein, the left posterior branch, left anterior branch, right branch of portal vein. This is the gallbladder. This is the median lobar fissure. This is the ligamentum teres, this area giving posterior shadow, this triangular area. This is the ligamentum teres in transverse section and the same in longitudinal section. This is the ligamentum teres. Now I'm going towards the pancreas. So as I move the probe towards the pancreas, in the epigastric region transversely, I straight away, now I have gone longitudinally in transverse section. I see large, solid, inhomogeneous mass anterior to the aorta, and there are not one, there are many encircling the aorta on both sides. Now when I go to the L4, L5 region, that is the umbilical region, here we are with three large hypoechoic focal lesions. One, now this measures, these are solid hypoechoic, well demarcated focal lesions. Now this measures 41 by 38 centimeters. This anterior one anterior to the aorta measures 51 into 26 millimeters, and there is another one here. Now these are these the lymph nodes? This is the spine, this is the aorta in transverse section. Now are these hypoechoic solid areas lymph nodes or retroperitoneal mass? These. So the age of the patient, the age of the patient is 30 years and the appearance is very healthy, has no history of weight loss. He does not give the history of temperature, fever, and just complains of pain for the last few months in the epigastric region. Now I'm going to see now. One of the ways to see the pancreas is to ask the patient to stand up so that the organs will come downwards and you will be able to see the pancreas in a better way. To rule out if these mass relate to the pancreas. Now this is the left iliac vessel. Anterior to it you do see a large hypoechoic solid mass. This is the left iliac vein, and this is the large hypoechoic well demarcated solid mass. You see, this is the area measuring 11.0 into 3.9. So in the left para-iliac region we see a mass, and there is another one posterior to the iliac vessel. This is the hypoechoic mass, well demarcated, very well demarcated. No posterior wall acoustic enhancement. This is the another one. No calcification within it. And on the right side, again there is a now this is the right iliac vessel. This is the right iliac vessel, and this is a very well demarcated hypoechoic solid mass, well demarcated. And there is no posterior wall acoustic enhancement, no calcification is seen within it. Get Now you see that the patient is healthy. His look is not toxic or that of a chronically ill patient, and his age is 30 years. I have placed the probe in the epigastric region, and then now you can see that as I place the probe, I straight away get the pancreas. Along with its landmark. Because the liver and the other viscera come downwards, and it becomes easy for you to see the pancreas. So the pancreas is normal. This is the splenic vein, the landmark for the pancreas. This is the superior mesenteric vein. This is the aorta in transverse section, and this white band of tissue is the pancreas. And we do not see any mass relating to the pancreas in transverse or longitudinal section. This is the head of the pancreas. This area, portal vein, caudate lobe, tegmentum venosum, the aorta. Here we see celiac artery dividing into two vessels. This is in the aorta, celiac trunk, splenic artery, and the left gastric artery. This is This is the splenic vein, this is the artery. So no abnormal, but from here downwards you start getting these well demarcated hypoechoic solid masses that are either large lymph nodes or retroperitoneal pathology, retroperitoneal masses, fibrosis with no mass effect on any organ or vessel insofar with pleural effusion, bilateral, minimal, and with diffuse decreased parenchymal echogenicity of the liver, and 3 well demarcated hypoechoic echogenic focal lesions of variable sizes with internal cystic areas, and they are all solid. 2 of them are in the anterior segment of the right lobe, one is in the posterior segment. Does not relate to any other organ, does not relate to the gallbladder, pancreas, the right kidney of the liver. They are within the liver. Now they differentiate. I am just going to give the findings, what I have seen, as this is the aorta. Now these are solid, well demarcated hypoechoic areas surrounding the aorta on the medial side, anteriorly as well as on the lateral side. This is the area of the L4, L5 spine, aorta, the umbilical region. In this case, as I am not provided with laboratory finding any other investigative procedure or detailed clinical examination history and nothing, so in such cases you just rely upon giving out the findings. Just narrate the findings in detail and leave the rest to the referring doctor, so that you may get a feedback later on. Thank you.